Hello, my name is Paul Duchenko, and I'm going to tell you a little bit about PSY9A4 Brain and Behavior Clinical Perspectives. This is a course taught by myself, Professor Ronan O'Carroll, and with the assistance of Katie Hamilton. Broadly, the course covers the basics of brain anatomy and function and considers various clinical conditions. So why study and why learn about the brain? Well, one reason is because many psychological disorders have a neural or a brain basis. So, for example, in Alzheimer's disease, you have a marked degeneration of the brain that causes difficulties in memory and personality. A second reason is because many psychological disorders have treatments that affect the brain. For example, in schizophrenia, one of the most effective or prescribed treatments is a treatment that alters the dopamine content in the brain. So what will you learn in this course? In this course, we'll start by considering some brain anatomy, and we'll teach you the basics of brain anatomy. Then we'll talk about the basics of sensory and motor systems, how we see the world and how we move. We'll talk then about disorders. We'll talk about speech disorders, disorders in producing speech and understanding speech. We'll talk about human amnesia, damage to parts of the brain that cause difficulties produce difficulties in remembering things. And we'll talk about other disorders, for example, executive dysfunction, where you have changes to personality that are associated with damage to the frontal lobes.